Welcome! If you've recently had a colonoscopy, you might have received a lab report filled with medical terms and numbers. For beginners, this can seem overwhelming. In this video, we'll break down each section of a typical colonoscopy lab report, explain what the terms mean, and guide you on how to interpret the results. Our goal is to make you feel confident and informed when reviewing your own report or helping a loved one. Let's start by understanding what a colonoscopy is and why the lab report matters. A colonoscopy is a medical procedure that allows doctors to look inside your large intestine, or colon, using a flexible tube with a camera. It's commonly used to screen for colon cancer, investigate digestive symptoms, or check for polyps and other abnormalities. After the procedure, doctors may take tissue samples, called biopsies, which are then analyzed in a lab. The results are compiled into a lab report, which provides important details about your colon health. Understanding your colonoscopy lab report is crucial for your health. The report contains findings that can help detect early signs of disease, guide treatment decisions, and provide peace of mind. By learning how to read the report, you can have more informed conversations with your doctor and take an active role in your healthcare. Don't worry if the language seems complex at first. This guide will help you decode it step by step. The first part of your colonoscopy lab report is the header. This section includes your personal information, the date of the procedure, and the name of the doctor who performed it. It may also list the laboratory where the samples were analyzed. Always check this information to ensure the report is yours and that all details are correct. Mistakes in this section can lead to confusion or mix-ups with results. Next, you'll find a section describing the procedure itself. This includes the reason for the colonoscopy, such as screening or investigating symptoms, and any special notes about the process. It may mention if the colon was fully visualized or if there were any difficulties during the exam. Understanding this context helps you interpret the findings that follow. The findings section is where the doctor records what was observed during the colonoscopy. This might include descriptions of the colon lining, presence of polyps, inflammation, or other abnormalities. The language can be technical, but key terms like normal mucosa, healthy lining, or polyp growth are important to note. This section sets the stage for the lab analysis that follows. If the doctor took tissue samples or biopsies during your colonoscopy, this will be noted in the report. The report will specify where the samples were taken from, such as the ascending colon, sigmoid colon, or rectum. This information is crucial because it links the lab results to specific areas of your colon, helping doctors pinpoint any issues. Medical reports often use technical language. Terms like adenoma, hyperplasia, or dysplasia may appear. Adenoma refers to a type of polyp that can sometimes become cancerous. Hyperplasia means an increase in cell number, usually benign. Dysplasia indicates abnormal cells that could be precancerous. Familiarizing yourself with these terms will help you better understand your report. The pathology section is where the lab describes what was found in the biopsy samples. This part is often written by a pathologist, a doctor who specializes in diagnosing diseases by examining tissues. The report may include descriptions of cell types, presence of inflammation, or any abnormal growths. This section is key to understanding whether there are any concerning findings. In the pathology section, you may see terms like benign, malignant, or negative for dysplasia. Benign means non-cancerous, while malignant indicates cancer. Negative for dysplasia is a good sign, meaning no abnormal or precancerous cells were found. Understanding these distinctions helps you gauge the seriousness of the findings. Colonoscopy reports often mention different types of polyps. Hyperplastic polyps are usually harmless and rarely turn into cancer. Adenomatous polyps have a higher risk of becoming cancerous over time. The report may also mention sessile, flat, or pedunculated on a stalk polyps. Knowing these terms helps you understand your risk and what follow-up may be needed. Sometimes the report will mention inflammation or colitis. Colitis means inflammation of the colon lining, which can be caused by infections, autoimmune diseases, or other conditions. The report may specify the type, such as ulcerative colitis or microscopic colitis. Recognizing these terms can help you understand the underlying cause of your symptoms. If dysplasia is found, the report may grade it as low-grade or high-grade. Low-grade dysplasia means the abnormal cells are less likely to become cancerous, while high-grade dysplasia is more serious and may require closer monitoring or treatment. Understanding this grading helps you and your doctor decide on next steps. The report may comment on margins, which refers to whether the entire polyp or abnormal tissue was removed. If margins are clear, it means no abnormal cells were left behind. If margins are involved, some abnormal cells may remain, and further treatment could be needed. This information is important for your follow-up care. Sometimes, the lab uses special stains or tests to look for infections, certain proteins, or genetic changes. These may be mentioned in the report as immunohistochemistry or molecular testing. These tests help clarify the diagnosis and guide treatment, especially if something unusual was found. Most reports end with a summary or impression. This section provides a brief overview of the main findings and their significance. It may include recommendations for follow-up, such as repeat colonoscopy or additional tests. This is often the most important part for patients, as it translates the technical details into actionable advice. The recommendations section may advise you to return for another colonoscopy in a certain number of years, or to have additional tests or treatments. These suggestions are based on your findings and risk factors. Following these recommendations is key to maintaining your colon health and preventing future problems. Let's walk through a sample colonoscopy lab report together. We'll look at each section, highlight the key terms, and explain what they mean in plain language. By the end of this walkthrough, you'll feel more comfortable reading your own report and understanding what the findings mean for your health. At the top of the sample report, you'll see patient information, name, date of birth, and medical record number. Always double-check this to make sure the report is yours. Next, you'll see the date of the colonoscopy and the name of the performing physician. These details are important for your records and future reference. The indication section explains why the colonoscopy was performed. For example, it might say screening for colon cancer, family history, or evaluation of symptoms. This context helps you and your doctor interpret the findings and plan next steps. In our sample report, the findings section notes 2 polyps found in the sigmoid colon. It may describe their size, shape, and appearance. For example, 5 mm sessile polyp means a small, flat growth. These details help determine the risk and need for follow-up. The report specifies that biopsies were taken from the sigmoid, colon, and rectum. This information links the pathology results to specific areas, which is important for monitoring and treatment. Always note where samples were taken from in your report. In the pathology section, the report might say, benign hyperplastic polyp, no dysplasia. This means the polyp is non-cancerous and there are no abnormal cells. This is a reassuring finding and usually requires only routine follow-up. If the report says tubular adenoma with low-grade dysplasia, it means a type of polyp that could become cancerous was found, but the risk is low. Your doctor may recommend more frequent colonoscopies to monitor for changes. Understanding this helps you stay proactive about your health. A report might mention chronic colitis or active inflammation. This means the colon lining is irritated or inflamed, which could be due to infection, autoimmune disease, or other causes. Your doctor will use this information to guide further testing or treatment. If the report says margins clear, it means the entire polyp or abnormal tissue was removed and no abnormal cells were left behind. This is a positive result and usually means no further immediate treatment is needed. If the report says margins involved, it means some abnormal cells may remain at the edge of the removed tissue. Your doctor may recommend additional treatment or closer follow-up to ensure all abnormal cells are addressed. The report may mention special stains, such as immunohistochemistry, negative for CMV. This means the lab checked for a specific infection or marker and did not find it. These tests provide extra information to help clarify the diagnosis. The summary section might say, 2 polyps removed, both benign, no evidence of cancer or dysplasia. Recommend repeat colonoscopy in 5 years. This gives you a clear overview of your results and what to do next. If you come across terms or findings you don't understand, don't panic. It's common for medical reports to use complex language. Make a note of any words or phrases that are unclear and bring them to your doctor's attention at your next appointment. Your healthcare team is there to help explain and guide you. Certain findings in your report may require urgent attention, such as malignant cells, high-grade dysplasia, or incomplete polyp removal. If you see these terms, contact your doctor promptly to discuss the next steps. Early action can make a big difference in outcomes. Keep all your colonoscopy and lab reports in a safe, organized place. Create a folder or digital file for easy access. This helps you track changes over time and ensures you have the information handy for future appointments or second opinions. Schedule a follow-up appointment to review your lab report with your doctor, bring a list of questions or concerns, and don't hesitate to ask for clarification. Your doctor can explain the findings, discuss any risks, and help you make informed decisions about your care. When discussing your report, consider asking, what do these findings mean for my health? Do I need more tests or treatment? When should I have my next colonoscopy? Are there lifestyle changes I should make? These questions help you get the most out of your appointment. Keep a personal health record that includes your colonoscopy dates, findings, and follow-up recommendations. This helps you and your doctor monitor your colon health over time and spot any changes early. Your report may mention risk factors like family history, age, or previous polyps. These factors influence how often you need colonoscopies and what follow-up is recommended. Knowing your risk helps you take proactive steps for your health. Healthy lifestyle choices can reduce your risk of colon problems. Eating a balanced diet, exercising regularly, avoiding smoking, and limiting alcohol all contribute to colon health. Your doctor may mention these in the recommendations section of your report. Your report will often recommend when to have your next colonoscopy. This could range from 1 year to 10 years, depending on your findings and risk factors. Following these recommendations is important for early detection and prevention. If your report suggests further testing, such as imaging or genetic tests, don't be alarmed. These are often precautionary and help your doctor get a complete picture of your health. Ask your doctor to explain why the tests are needed and what they involve. Medical reports are full of jargon. Don't hesitate to look up terms or ask your doctor for plain language explanations. Over time, you'll become more comfortable with the terminology and better able to advocate for your health. There are many reputable online resources that can help you understand your colonoscopy report, such as medical society websites and patient advocacy groups. Use these resources to supplement your doctor's advice, but always confirm information with your healthcare provider. Your colonoscopy report contains sensitive personal information. Keep your records private and only share them with trusted healthcare providers. If you need to send your report electronically, use secure methods to protect your privacy. Reading a colonoscopy lab report can seem daunting, but by breaking it down section by section, you can understand the key findings and what they mean for your health. Remember to check your personal information, understand the findings, and follow your doctor's recommendations. Stay proactive and informed for the best outcomes. By learning to read your colonoscopy lab report, you empower yourself to take charge of your health. Knowledge is a powerful tool that helps you make informed decisions, communicate effectively with your healthcare team, and ensure the best possible care for yourself and your loved ones. Thank you for joining us on this beginner-friendly guide to reading a colonoscopy lab report. Remember, you're not alone. Your healthcare team is there to support you every step of the way. Stay curious, stay informed, and take good care of your colon health. Wishing you wellness and peace of mind.